Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Ratbite treatment with or without infection. A rat bite can be dangerous if it develops into a bacterial infection called ratbite fever. If you are bitten by a rat, take it seriously and treat it right away. /r/n/r/n While rats are generally more afraid of you than you are of them, you can never be sure how a wild animal will act. Even pet rats can bite if they are frightened and can harbor the same kinds of bacteria in their mouths as wild rodents. /r/n/r/n This article explains the different types of infections that can occur from a rat bite, how to treat the bite at home, and when to call a healthcare professional. /r/n/r/n Brianna Gilmartinrnrn There are several steps should take right after you or someone else has been bitten by a rat. /r/n/r/n Even if you have treated the bite at home, always consult your healthcare provider after a rat bite. You may need a tetanus immunization or stitches. Wounds on the face or hands are of special concern due to the risk of scarring or loss of function and should always be evaluated. /r/n/r/n A rat bite looks like a small puncture wound or small cut. Rat bites often lead to infection. Symptoms of rat bite fever usually begin within 3 to 10 days after being bitten. If the wound shows any of these signs in the days after a bite, it may be infected. /r/n/r/n Rat bite fever is not common. However, cases may not always be identified since the bacterial are difficult to diagnose, and the condition often responds well to prescribed antibiotics. There are between 20,000 and 40,000 rat bites in the United States each year. The risk of developing rat bite fever is estimated to be about 10%. /r/n/r/n Petting or handling an infected rat can transmit the bacteria even if you aren't bitten. People can also get RBF by eating food or drinking water contaminated by rat feces. If rats are able to enter your home, it is possible for them to bite people in their sleep. /r/n/r/n The two bacteria responsible for rat bite fever are /r/n/r/n The signs and symptoms of infection from each bacterium are slightly different. Fortunately, rat bite fever can be effectively treated with an antibiotic. If left untreated, though, rat bite fever can potentially be fatal. /r/n/r/n Watch for the following symptoms and seek medical attention right away if you experience any of them. /r/n/r/n Symptoms of rat bite fever usually appear 3 to 10 days after the exposure or bite but may occur up to 3 weeks later. A rash usually appears 2 to 4 days after the fever. /r/n/r/n Just because the bite or scratch seems to be getting better, don't assume you're in the clear. The infection can still be in your body. In fact, you may not have a fever until after the wound is healed. /r/n/r/n Complications from S. moniliformis infections include the formation of pockets of infected fluid, called abscesses, in your belly or other parts of the body. The infection can also lead to hepatitis, meningitis, pneumonia, and a kidney disorder known as nephritis. /r/n/r/n Approximately 10% of people who develop S. moniliformis die of the infection. /r/n/r/n Symptoms of S-RBF usually come on 1 to 3 weeks after being exposed to an infected rodent. They are more variable than streptobacillus RBF, but may include /r/n/r/n Without treatment, S-RBF can be fatal as the infection spreads to the heart, brain, lungs, or other internal organs. /r/n/r/n Rats are not a major source of rabies infection. In fact, it's very rare for humans to contract rabies from any rodent. Bat bites are the most common source of rabies. Raccoons, skunks, and foxes can also transmit the disease. /r/n/r/n Another form of rat bite fever is haverial fever. You can contract this type of infection if you consume food or fluids that have been contaminated by bacteria from a rat. Symptoms may include severe vomiting and a sore throat. /r/n/r/n Ratbite fever should always be treated by a doctor. If untreated, ratbite fever can cause serious complications that could lead to death. Your doctor will prescribe antibiotics, which may include /r/n/r/n. Patients with severe forms of ratbite fever that affect the heart may receive high-dose penicillin and the antibiotics streptomycin or gentamicin. /r/n/r/n. Ratbite fever is a serious infection that is often harmful to humans. Moniliformis bacteria found in American rats is associated with rash and flu-like symptoms. bacteria found in Asian rats may cause swollen lymph nodes and irritation around the wound. Both types of bacteria cause an infection that can be fatal if it's not treated. /r/n/r/n. Thankfully, the condition can be cured with antibiotics. Avoiding interaction with rats whenever possible is the best prevention, but if you do find yourself bitten, scratched, or even exposed to a rat, contact a health professional right away. /r/n/r/n. Yes, it is possible to get ratbite fever from a mouse. Other rodents can carry the bacteria for ratbite fever, including mice, squirrels, gerbils, and guinea pigs. If you are bitten by a mouse or other rodent, be sure to clean the wound and contact your healthcare provider. /r/n/r/n. Mice can carry rabies, but it is extremely rare. There are very few documented cases of rabies-infected mice. In addition, it is unknown if they can transmit it to humans. The same is true for hamsters, guinea pigs, chipmunks, rats, rabbits, and hares. To be on the safe side, it may still be worth contacting your healthcare provider if you get bitten by a rodent or wild animal. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.